Asthma and reactive airway disease, RAD, are both respiratory conditions that affect the airways and lungs, with similarities and critical differences that distinguish them. Asthma is characterized by chronic inflammation leading to wheezing, shortness of breath, chest tightness, and coughing that varies over time and in intensity. In contrast, RAD refers to a nonspecific pattern of reversible airway obstruction, often presenting with similar symptoms but typically used to describe transient respiratory issues, particularly in children after an infection or irritant exposure. Treatment for both conditions may involve the use of inhalers, steroids, and avoiding triggers, though management strategies can differ depending on the underlying causes and severity. Individuals with a family history of allergies or asthma, or those exposed to environmental factors like tobacco smoke, are at higher risk for developing these conditions. Here's a closer look at the detailed aspects of asthma and reactive airway disease. Onset of symptoms, sudden versus gradual. Asthma is typically characterized by chronic inflammation leading to airway hyperresponsiveness that can cause symptoms like wheezing, shortness of breath, chest tightness, and coughing. These symptoms can develop over time and vary from mild to severe episodes known as asthma attacks. Conversely, reactive airway disease, RAD, often refers to a transient condition with similar symptoms but is usually triggered by an acute event, like a respiratory infection. RAD symptoms can appear suddenly and may resolve relatively quickly with treatment or removal of the trigger, unlike asthma, which requires long-term management and may have a more gradual symptom onset with a pattern of chronic exacerbations and remissions. Age of onset, early childhood versus any age. Asthma is a chronic respiratory condition often diagnosed in early childhood, characterized by inflammation and narrowing of the airways, leading to symptoms like wheezing, shortness of breath, chest tightness, and coughing. In contrast, reactive airway disease is a term commonly used to describe a transient condition presenting similar symptoms as asthma, but without a definitive diagnosis. RAD can occur at any age, frequently triggered by respiratory infections or environmental irritants. While asthma tends to have a genetic predisposition and a potential for long-term management challenges, RAD-D is often a short-term reaction that resolves with treatment and avoidance of triggers. Distinguishing between these two conditions is crucial for appropriate management and therapy. Triggers: allergen-specific versus non-specific irritants. Asthma is a chronic inflammatory disease of the airways, commonly triggered by allergens such as pollen, mold, and pet dander, leading to bronchospasm, edema, and mucus production. On the contrary, reactive airway disease RAD is a general term used to describe a hyperresponsive state of the airways, often responding to nonspecific irritants such as smoke, strong odors, or cold air. Both conditions present with similar respiratory symptoms like coughing, wheezing, and shortness of breath. However, the management strategies differ. Asthma is typically controlled with long-term medications, including inhaled corticosteroids, whereas RAD treatment is more about avoiding known irritants and may involve short-acting bronchodilators to relieve acute symptoms. Understanding these trigger distinctions is critical for tailored therapy and improved quality of life for patients. Chronicity, long-term versus transient. Asthma is often a chronic condition characterized by inflammation and narrowing of the airways, leading to difficulty in breathing, wheezing, and coughing. Its chronic nature means that individuals with asthma tend to have recurring episodes and typically require long-term management, including the use of inhaled corticosteroids. On the other hand, reactive airway disease, ARAD, is a term sometimes used to describe a transient, reversible condition with symptoms similar to asthma. However, RAD is not a well-defined medical diagnosis and is often used in reference to children who exhibit asthmatic symptoms following a respiratory infection. Unlike chronic asthma, these symptoms are usually temporary and may not necessitate enduring treatment, resolving as the underlying trigger, such as the infection, is addressed. Response to medication: steroid responsive versus variable response. Asthma and reactive airway disease, RAD, often present with similar symptoms such as wheezing, coughing, and shortness of breath, but they diverge in their response to medication, specifically steroids. Asthma, a chronic inflammatory disorder of the airways, typically shows a good response to corticosteroids, which reduces inflammation and airway hyperresponsiveness. Patients with asthma may often have a predictable and consistent response to these medications, leading to improved symptoms and lung function. On the other hand, RAD, which is not a precise diagnosis, but rather a descriptive term for transient wheezing episodes, can show a variable response to steroids. RAD may not always involve chronic inflammation, and its responsiveness to steroids can fluctuate, reflecting the diverse underlying causes, such as respiratory infections or irritants. This difference in medication response can be a pivotal factor in distinguishing between the two conditions and tailoring an effective treatment strategy.